Hi, everybody. Please let me know if you are able to hear me. Raise your hand or give me a thumbs up or something. Okay, sweet. Hello, hello. I am Dr. Adams, and welcome to the Full Circle Women's Care Pregnancy Orientation Webinar. Some of you I just saw a little earlier in the week for your history visit, and some of you I will be seeing tomorrow for your history visit or possibly even next week. If you were watching the replay of this, in the beginning, we show a collage of pictures that patients have sent over the years, holiday cards and birth announcements. And I do hold on to all of those. And one of my favorite cute little babies is at the point of the heart. And she always makes me smile. So later on, please feel free to send me your announcements and holiday cards later on because I do keep them in what I call my happy drawer. Happy drawer. All right. So we're going to go ahead and get started with the presentation, and you should be able to see it coming up just shortly. It will, oops, let's see. Message I have full bars. It keeps skipping and I can hear you. Is it skipping for anybody else? Raise your hand if it's messing up for anybody else. I mean, I know you're not able to see the presentation right now, but is the audio okay? Like, give me a thumbs up if the audio is okay. Okay. All right. Excellent. Okay. So now we're just waiting for this. You decide, we deliver. Very awesome. That that was me at my third pregnancy. Why does this stick have two lines? It's not supposed to have two lines. I'm sure you guys are all excited that your stick had two lines. So today we are going to just go through a couple of housekeeping items here. First of all, this is confidential. So if you ask me questions, no one else will be able to see who's asking those questions. I will answer them in such a way so that no one is able to tell that it's you. If I think it's something too personal and someone might be able to guess who you are, I may say, let's table this conversation to one of your visits. So please participate. I know you guys have notebooks full of questions or maybe little text threads with yourself, things you're going to ask. But feel free to go ahead and ask. There are no silly questions. And finally, this entire presentation will be available for the entirety of your pregnancy on our YouTube channel at Full Circle Jacks. So we're going to start with a poll question. So this is how the polls will go. First, I'm going to say who's on the line. How many first-time moms do we have here? And how many mommy veterans do we have on the line? When you answer these poll questions, it helps me to direct how I tailor the rest or the next part of my conversation. So I am waiting for you all to answer this poll question. Who's a first-time mom and who's a mommy veteran? You may have to scroll down past the picture to see your selections. Go ahead and make your choices, and then I will say the poll ends. Sweet. So it's pretty even. We have an even crowd today, about half and half. The mommy veterans edged out the first-time mommies by just a little bit. Okay, so for mommy veterans, it's not your first rodeo. The pregnancy is a blur. You don't remember what you did when, you just know something happened at some week. So we're going to go back through a lot of things today, including the full circle experience, which includes what to expect at each visit, where we deliver. We're going to go over some office protocols. We'll go through where to find the information on what to expect at your visits, give you some other prenatal resources, do a review on exercise and nutrition specific to pregnancy, and then wrap up with a COVID-19 update. So let's start with the philosophy of Full Circle. We are a collaborative midwifery model practice, which is based on the premise that pregnancy and birth are normal life processes. This is not a disease you've contracted that we have to cure you from. This is something that is physiologic. This is supposed to happen. Your body is supposed to do this in order for life to continue here on earth. In the traditional midwifery practice, they take care of normal, low-risk women, but if they identify certain abnormalities, you may have to transfer out of their care in order to have access to other accoutrements, if you will. In the collaborative model, though, you are able to stay in the care of the midwife with physician direction for any of these pregnancy abnormalities. Like, say, for example, your baby is breech. You know you're probably going to have to deliver by C-section, but you can still continue with the midwifery model of care, which focuses on holistic pregnancy care. Um, to that end, the majority of our labors and deliveries are attended by our certified nurse midwives. And I say majority because the docs do some vaginal deliveries too. So if you see me walk in a room, don't freak out. It doesn't mean something is wrong with you. But for the most part, for our normal laboring patients, including our vaginal birth after cesarean, the certified nurse midwives are there. Now, if there are things that occur during your labor that are outside of their scope, physician consultations are available 24 hours a day to them. If it's something urgent, urgent meaning cannot wait until morning or something like that, it will be someone from Full Circle, either myself, Dr. Marrow, Dr. Mooney. And if it's something emergent, meaning it can't wait the 15 minutes it takes for one of the three of us to get to the hospital, there are board certified obstetrician gynecologists who are in-house 24 hours a day. To put it in perspective, it is very rare that there are true emergencies. We did over 540 deliveries in 2022, and only 2 of them did we employ the use of the OB hospitalist for emergencies, like worried about something. Most common use for the hospitalist is somebody comes in 10 centimeters and we don't have time to get to the hospital. So please also let us know when you're going to the hospital. So where we deliver, we are, as of November 1st, at HCA Florida Memorial Hospital on University Boulevard. Some of you who delivered with us before remember we used to be at Ascension, but we made the move over to HCA and it has been awesome. You can read a lot of our most recent reviews, both on Facebook and Google, and see that it's just been a tremendous change for us and for our patients. They do have tours available. They have one-on-one tours, and then they have quarterly stork tours. They actually just had a stork tour on February 22nd. So the next one won't be for another 3 months. But in the interim, you can call the midwives, have the phone number. You can call the director of women's services. They'll do them during the day. They do them in the evenings, on the weekends. They're very accommodating to be able to tell you exactly, to show you where to go and show you where you're going to get to meet your little one. The question I have out there is there still an option to deliver with Ascension? And no, there isn't. We are now only at HCA. The next question I have is, will the in-house physicians know our medical background? Typically, in an emergency, all they need to know is your emergent situation. I mean, they'll know you're pregnant and how pregnant you are, but usually they don't need to know like you have thyroid disorder or something like that if they are concerned. Like I said, they intervene if it's baby is crashing or you are bleeding, and we don't have 15 minutes for somebody to come in who actually knows who you are. HCA also offers classes. They have childbirth education classes. So they have the comprehensive ones, which are 5 weeks, and then they have the crash course, which is a weekend course for moms for labor, delivery, and newborn care. They have breastfeeding classes, and they have sibling classes. So for my veteran moms who are worried about introducing a new human into the household, it helps. This is super cute. It prepares big brothers and big sisters, or future big brothers and big sisters, for the new baby who's entering the home, which is kind of cool. Next question I have out here. I saw the doula's reviews say her client labored in a tub. Is there an option for water births? Not for water births, but hang on to that question. We are going to answer that a little bit later on. Let's move now to our office hours. The office is open Monday through Thursday from 9 to 1. We then close for lunch from 1 to 2, and then reopen at 2 o'clock, and we're open until 5 p.m. So if you call us between 1 and 2 on Monday through Thursday, you will get the after hours line. The reason it rolls to the after hours line is if there is an emergency during that time, that actually reaches out to the provider who is on call. So if you have an emergency, you can still reach a clinical staff person. But if you have an administrative concern between 1 and 2, I need to change my insurance, update my pharmacy, what have you, please wait and call us back after 2 p.m. Please don't leave an administrative voicemail on the clinical after hours line between 1 and 2. On Fridays, we are open from 9 to 1. and we close for the weekend. So if you're calling with an administrative issue at 12:57 on a Friday, please know that you might get your answer on Monday when we reopen at 9 a.m., unless it's a holiday. There aren't very many holidays. We do not have walk-in appointments here. And that is because our goal is to see you at or as close to your appointment time as possible. When you're walking in, our goal is to have you walking back and getting into a room. We cannot do that if you planned to see me at 2 p.m. and someone else has something that they walk in for at 1:55 and says, I need to be seen right now. I would not give them your scheduled time. And so we can't accommodate walk-in appointments typically. Now, if you have a situation that you need to be seen fairly quickly, you can give us a call in the morning. Sometimes people have delivered or canceled for the day, and we have a limited number of same-day appointments. But if you're calling and you're saying we think, hey, you do actually need to be seen, but we don't have any same day appointments, we might recommend that you go either to urgent care or to the hospital to be seen. It's not us saying that we don't want to see you. It's us saying that we actually do agree with you. This is something that does need to be seen. It's not something that should be have you sitting in our lobby for an hour waiting to be worked into our schedule because y'all know how I am about time. I try to be as respectful of your time as possible. Also, next slide, I believe, is up for you already. Providers are not able to leave patient appointments to take phone calls. When you schedule an appointment with me, that is your time. So I will not be leaving your appointment to go talk to anybody else unless it's the hospital with an emergency, which, again, as we know, are few and far between. And if you do call, you have to leave us a message in order for us to call you back. People pocket dial their gynecologists all the time. And so we don't just go through caller ID and call people back. When you call and you leave your message, please be sure you're leaving your message in the right place to get the most efficient turnaround. And who do you leave your message with? That's a great question. So if it is an administrative issue, FMLA forms, disability, things like that, or if you have a clinical question, not sure about my baby's movements, not sure if I'm having contractions, maybe I have a UTI or yeast infection, Tony is our nurse who takes those phone calls. She has information from us on how we would like things triaged. So she has a set response for most things because the same things come up in pregnancy over and over. If it's something outside of the scope of which she's used to answering, she knows how to get in touch with the on-call provider and get you an answer in a timely fashion. Please give her a moment to take down your call, your message, transcribe it, ask one of us, and get back to you. Sometimes she'll get a phone call, and before she can answer the phone call, you've already called the front desk, sent 2 portal messages. Just hold on. She will definitely get back to you. If it can't wait for Tony to get back to you, then it may require a trip to an urgent care facility. It sounds like an urgent matter. If you need something coordinated from an OB clinical standpoint, Naisha, who many of you have already heard from with regard to your labs, Naisha is in charge of correspondence with the labs. If you need referrals, like if you need to see the high risk doctors for some reason, if at the end of pregnancy you need something scheduled like your C-section, your version, your induction, or baby circumcision, she's the one that handles all of those things. And then if there's something about your insurance, you want to talk to Renee Hall. I think everyone on here has met her probably at least once after your confirmation. She went over your insurance benefits. So if for any reason your insurance is changing, please reach out to Renee first because we don't want to still be collecting on an old prepayment plan that doesn't apply anymore. Or if you're going to owe a lot, we want to give you kind of a heads up of what's going to happen in the future if things change. All right. After hours, so I gave you the hours that we are open, but there is still always somebody on call for our practice 24 hours a day, and it's someone from our practice. So the emergency on-call provider, this, like you're thinking, I may need to go to the hospital. And again, you have to leave a voicemail in order to receive a call back. The phone does not register if a voicemail is not left. So this is not the call for, oh, I lost my lab slip today, or Dawn forgot to print out my whatever. This is for, I think the baby's coming, or I'm really concerned and I need to go to the hospital. Remember, the person who's on call is also the person who is covering the hospital. So she may answer and say, hey, I'm in a delivery. That was actually me just last night. Hey, I'm in a delivery. Can I call you back? If again, it's something that cannot wait until she's able to call you back, go to the hospital. That's where she is. So just know that after hours, it is the same phone number. Just follow the prompts to get to the on-call person. It's at the end of the outgoing message. The patient portal is another way to contact us, but please remember that the response times can take up to 2 business days. So if you send a message on a Thursday, the next business day is Friday, the next business day is Monday. Some of our providers are only here part-time, like Lauren's here on Tuesdays and Wednesdays. So for her, the business days are a little bit more sparse. She usually does try to log in at the end of the week to just double check if someone has sent her anything from the people that she saw in the office. The portal is appropriate for action items. Like I did forget my lab slip. Can you email me a new one? I want to get those labs done before I come in. But if it's a non-action item, like I'm taking a new vitamin or a new supplement, and I just want to know if it's okay. You don't have to start the supplement today, unless it's something that we recommend and you want to know if you made a good selection. But if it's a non-action item, we may just forward it to the person who's going to see you at your next appointment because we are going to be seeing you a lot. So again, my example of losing the lab slip, or let's say you were diagnosed with COVID and you need to maybe transition your appointment from an in-person one to a virtual appointment. If your appointment is more than 2 business days away, that's a reasonable way to communicate with us and we can get it to the front desk so that we can transition that appointment for you. Things you don't want to put on the portal. Urgent matters. Please don't send me, I'm bleeding heavily, my blood pressure's through the roof, I have a headache that won't go away, my baby's not moving. Y'all, my blood runs cold when I open up a portal message that has been sitting there for 36 hours and it's someone saying, I am having preterm contractions, or I haven't felt my baby move, and now it's been a day and a half and no one has evaluated it. Those are urgent matters. That is what our after hours phone call line is for. So please make those phone calls and not portal messages. Other things you don't want to send on the portal. Blitz messages. So if you've sent one message, remember 2 business days. Please do not then send the same message to somebody else and somebody else and somebody else and somebody else. That's provider phishing. It's also portal abuse. And the computer will sometimes think if you're cutting and pasting a message multiple times to different people that you are a bot trying to spam us, and it will delete your portal account altogether. And it's really hard to get those reinstated under the same account. So multiple messages to one person and or the same message to different providers, you want to avoid doing that. Also, please don't try to have a full appointment over the portal. People will scan in 200 pages and say, can you take a look at this article and tell me your thoughts? What are the risks and benefits and treatments? That's a visit. So we are here from 9 to 5 every day doing visits. Please text yourself any questions so that you can remember to bring those questions to your visit or schedule an appointment. Bring those papers with you and we can go over them together. The portal is what we do in our off time after we've seen patients all day long, ordered all the labs, reviewed all the studies, sent everything out to the portal to you. Then we just go through and see if there's anything we can do to make your life easier. But that's really our time that we want to be spending with our families and not reviewing herbs and supplements. So please don't have the appointments over the portal. Come on in. You have beautiful faces. We want to see you here in the office. Have an appointment in the office with us. All right. Other things that go out over the patient portal include ultrasounds. Unless there is something urgently abnormal, we have to download the ultrasound report and then it gets uploaded into our electronic medical record system, divided amongst the providers, and then reviewed and sent out to you. So from the time you have your ultrasound, please give us 2 business days to receive the report, review it, and release it to you with our commentary. Now, if you know that your anxiety is not going to let you wait 2 business days to find out what was on that report, please be sure you are scheduling a prenatal visit on the same day following your ultrasound visit. So typically the final report isn't ready, but the provider can usually give you a preliminary idea of what's on the report if there's anything that needs follow-up. Otherwise, if you need a follow-up ultrasound, the sonographer will typically tell you, hey, we want to take a look at baby again in about 4 to 6 weeks. And then in a couple of days, you'll hear exactly what it is they want to look at. Whatever it is not urgently abnormal. It may just be we think that the placenta is a little low, or we're looking at how the cord is inserted into the placenta. Nothing detrimental to the baby. If we're worried about anomalies or something really dangerous to the baby, one of us will break our schedule. They will put you in a room and we will not let you leave the building until we discuss what we found on the ultrasound and make a plan for it. Right? So please give us time to review it and respond. You know who else has a portal? Quest. It's super annoying because they send the results to you before they send them to me. And then you get them and you see all this red all over the paper and it freaks you out and y'all get on that portal, clickety clack. So when you see red on your prenatal results, just know that red doesn't necessarily mean abnormal. The reference ranges that they're using on there for normal are for non-pregnant individuals. Pregnancy changes things. So it changes how some of your organs work, and the reference ranges are different for pregnancy. So give us a chance to receive the labs from Quest, to review them, and to send them out to you. Now, if you've had the labs for over a week and you haven't heard anything from us, then definitely let us know, because there's a possibility Quest didn't send it to us at all and we need to reach out to them and get it. But please don't receive your labs, see red, and immediately upload them to the portal to us, because I review no less than 70 labs per day, and I won't remember if I reviewed your labs 2 days ago and then you sent them to me, and then Quest sends them to me again. And it's enough for me to see them once. I would rather not repeat what I'm doing, because I could be moving on to do something else to serve you better than reviewing your labs 3 times. So we will get them, we will review them, and we will release them to you with any commentary. We typically send prescriptions if they're necessary in real time and explain them when we release them in our commentary there. And you can reply back with questions on anything that we release. Finally, any questions on how to communicate with us? All right, awesome. Okay, next thing we're going to move into will be your prenatal visits. So first thing you can expect is that you are going to forget every single question you have to ask us as soon as you walk through the door. So please start a text thread with yourself that is prenatal text thread, and you can ask the question so that you bring it with you. You always have your phone with you, and when we say, do you have any questions, you can just grab that phone and say, actually, I do. So you also want to wear loose, comfortable clothing so that we can access your belly. Y'all are my summer belly crowd, so little shirts that you can lift. Dresses, sometimes when you lift the dresses, if you're not wearing little shorts underneath, we can give you a drape. If you brought a bunch of people with you and you're not too keen on showing them your skivvies, then maybe putting shorts on under the dress. But we want to get to that belly. So every single visit, we are going to listen to the baby's heartbeat. Not necessarily do an ultrasound, but we will use a Doppler. We should hear baby's heartbeat every time you come in. So we need to get to that belly. Rompers are a really difficult outfit to wear here, because then you're having to take off your straps and all that other stuff. So just lift up, pull down so we can get to your belly. Please come in about 5 minutes before your appointment time, so you'll have time to check in, handle any insurance stuff at the front desk, and leave us a urine sample if you need to. We're not routinely collecting urine on everyone. ACOG says we don't need to do that anymore. You'll know if you need to leave us a urine. It's typically if we're following you for blood pressure issues and looking for protein, or blood sugar issues and looking for glucose in your urine, or if you recently had a urinary tract infection and we need to make sure that it's all cleared. So if you're not any of those people, front desk usually will be able to tell you, we know you are pregnant, you've been drinking your water all day, better be drinking your water all day, and you have to go to the bathroom. So when you come in, you can head straight to the bathroom. No need to leave us a urine sample unless you fall into one of those special categories. If you are 10 minutes late, we will still have time to check on you and the baby, but that obviously leaves less time for your text thread questions. If you're 20 minutes late, you have missed the entire appointment slot. As I said, sometimes people do cancel and we have ability to work you in a little later in the day. Front desk is actually really good about this. I know sometimes there's accidents on JTB and that sort of thing, and they'll realize, oh my gosh, she's totally missing her 220, but this one over here has a 240. great. I'll just slide her over onto this person's schedule so that by the time you come in, you're already rescheduled to another time. If when you come in, though, that time does not work for you, because it may not be 2:20 to 2:40, it might be 2:20 to 3:20. If it doesn't work for you, no big deal. It was just our attempt to try to accommodate you, but we can try to either work you in later in the day or reschedule. But we do also still want to be mindful of the people who were able to make it to the appointment on time who are coming in behind you and not have our day backlog. Next. Diagnostic ultrasound visits. So people always want to know is when am I having an ultrasound? Because I want to bring my family with me. That's a great question because you're not having them at every single visit. They are separate from your routine prenatal visits. The way to know if you have one scheduled is to check in your portal whether you have more than one appointment time and is there a provider's name associated with your visit. So Tina Test, my imaginary test patient, logs into her portal and she clicks on the appointment button and Tina sees that she has two appointments scheduled. She has one appointment at 9:20 with ultrasound, which is not a provider's name. And then she has an appointment at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina knows she has an ultrasound. So she's going to ask her family to come hang out with her at 9:20 to take a look at the baby. And they're more than welcome to stay and hang out to talk about their results, the preliminary results with Dr. Yeckel at 10 o'clock. Now, if you don't see ultrasound on there, you're probably not scheduled for an ultrasound. If you think that you're supposed to be, please let one of us know. Call the front desk and let them know that you were supposed to be scheduled like your provider told you. I think this is on the next slide, actually. If you were told by one of your providers that you needed to have an ultrasound scheduled, let the front desk know. Remember that the results will come to you on the portal in 2 business days. Unless there is something urgently abnormal, then we will stop our day, we'll interrupt our day and talk to you and make a plan on that same day. When you check out from your prenatal visit, if your provider said, all right, it's time for your anatomy ultrasound, go ahead and get that scheduled too. Be sure you are leaving with 2 separate appointment times when your ultrasounds are due. That way you'll know both appointments are scheduled appropriately. If you think you need to look at your baby, but we say, actually, we don't have a medical reason to right now, guess what? There are people out in the city who want to look at your baby for money. Boutique ultrasounds are a thing, and these are just a couple of places in town. These are for informational purposes. We're not endorsing any one over the other, but I tried to just put a couple of different locations around the city. They have things like putting the baby's heartbeat in a stuffed animal, giving you 3D pictures. They do sneak peek gender reveals at like 14 or 15 weeks. So feel free to go and have these done. They are not dangerous. Ultrasounds are not radiation. They are just sound waves, and they're lots of fun. All right, so who is listening? When should you expect to get routine ultrasounds? The poll starts now. When should you expect to get routine ultrasounds? And the keyword here is routine. When are you going to be getting them? Will you get them at every visit, at 20 and 40 weeks, or only if you have a problem? And the polls are closing in 3, 2, 1, closed. All right. At 20 and 40 weeks is the answer. So your anatomy ultrasound is right around 20 weeks. And if we're able to see everything we need to see, then you will not need to get repeated ultrasounds. Sometimes babies don't cooperate and we can't see all the heart structures or the brain structures. And we need you to come back in 4 weeks or so to make sure that we can see everything. Not that we think something's wrong, but just babies playing peekaboo with us. That's not a routine ultrasound, but that would be a reason that you would get another one. So if everything looks good, unless you go past your due date, we don't need to look again as long as baby is measuring appropriately and you don't develop any other diagnoses that necessitate taking a look. All right, we are going to shoot over to our website now. This is fullcirclejacks.com. So this is our website. Lots of good information here for those who were with us at Ascension before and want to know why. We're no longer at Ascension. We did hold a virtual town hall in October, and it was recorded. So you can see there at the top, the banner says, if you missed it, please click there to watch the event and get all of your questions answered. And y'all know me, I will answer all the questions right there in that town hall. All right, as we scroll down here, we'll start with the providers. So, one of these lovely ladies will have the distinct pleasure of helping you welcome your little one or ones into the world. And so there I am back when more hair was a thing. And there's my buddy, Dr. Marrow. She's probably got about the same amount of hair now. Dr. Yeckel has cut her hair as well. Dr. Mooney still has a beautiful head of hair. I don't know why I'm on hair today, but anyway, the midwives have hair too. There's midwife Lauren, there's midwife Krista, there is midwife Dawn, midwife Cindy. We also have midwife Jane and midwife Missy. So all just amazing human beings and really excellent at what they do. This is literally our favorite thing to do. And we are so excited to be able to share what we love doing with you and the people you love. So other good information over here, and our bios are out there too. So feel free to click on any of them and learn a little bit more about each of us before you come in too. So over here under patient information, you will see the obstetrics tab. And when you click on it, you'll know you're in the right spot because you will see all the bellies that lead to the baby at the end. So the first thing on here is our statistics. And actually, we need to release our stats for the year. We usually do that earlier. Can't believe it's March already. Our statistics are out there back to 2018. And many of you are here because of our statistics. You're here trying to avoid a second C-section, trying to avoid a first C-section. So all of our numbers are out there. We're very transparent. Some years are better than others, but we always compare ourselves to ourselves and strive to get better every year. The next box here is the prenatal care timeline. We are going to click on that because I want to go over what to expect at each visit. And remember, all these things are out here on the website. You can download them, print them out, all that good stuff. So everyone on here has already had their dating ultrasound and met with one of the midwives afterward. You also met with Renee Hall to go over your insurance and all of that good stuff. Some of you have already had your OB history visit with me, which is where I order your routine prenatal labs. We also are very transparent in the labs that we order here too. When people transfer in, they say, I really don't know what labs I've already had. Here you go. I will always tell you which labs we are ordering, what things are standard and what things are optional. So the panel here in that first box, your blood type, blood count, serologies, and urine culture is part of the standard panel recommended by ACOG. Genetic testing is optional. Some of you have opted in to find out whether baby is at risk for Down syndrome or whether you're a carrier for certain genetic illnesses, or to do the nuchal translucency ultrasound. Then at this point in pregnancy, we're seeing you about every 4 weeks or so. So about 4 weeks after your initial visit in the office, the front desk has probably already scheduled you for your OB physical exam. And that is just like it sounds, a regular physical. So heart, lungs, breast exam, pelvic exam. Since we are doing a pelvic, if you are due for a PAP, you are free to, you can request that we do one on that day. The PAP really isn't part of the ACOG panel, but cervical cultures for STIs are. And so that's part of it. If you need a referral to the high-risk doctors and I haven't already sent it with your OB history visit, this is when they usually see you, right around 12 to 14 weeks. 4 weeks later, you're back in the office for us to just do a belly check and talk about normal physiologic changes in second trimester. Then we come up on the anatomy ultrasound around 20 weeks. You'll see there in the middle column too, a mental health screen. So depending on your background, we may screen for depression or anxiety or both. If you're meeting with one of the midwives on the same day, she may also begin to discuss childbirth education classes and or breastfeeding classes. Then about 4 weeks later, we're looking at doing the glucose test. And I know you'll have questions about glucose. Hold on to them for just a moment because I do have a whole section on the glucose test. My moms who know that they have a certain blood type, if you're Rh negative, we want to make sure that you have RhoGAM in-house so we can give it to you between 28 and 30 weeks. This is when you want to pre-register at the hospital. So hospital registration is all online. You create a portal account with HCA. And you do all your pre-registration there online. Scheduling a hospital tour, making sure that you've already either participated in one of the stork tours or gone in to see the new unit. And if you plan to work with a doula, which we'll talk about in a moment as well, you want to make sure you have her locked in around the first of your third trimester. Third trimester starts on the next page. This is when we start seeing you every 2 weeks. So my first time moms, you want to begin to interview pediatricians to select one that matches your philosophy for how you want to raise your child. What's important to you? Antibiotics, vaccines. Those are some questions that you want to know, and somebody who's close to you. For my veteran moms, want to figure out whether you're staying with the same pediatrician. Most of them do not come to the hospital, and so we just want to know where to send your new baby's records when he or she or they leave the hospital. If you have not gotten your tetanus booster, if you haven't gotten your flu vaccine, I don't think this is the flu month crowd. If you haven't gotten RSV, we don't give those vaccines here, but if you're looking for when you plan to get them, this is usually when people do in the early part of the third trimester. And you would go to either Minute Clinic or your primary care doctor to get those done. You'll see there in the middle column the option to repeat or decline your standard prenatal labs. So Duval County actually takes care of many different populations. Some are more at high risk for contracting STIs during pregnancy. And so in those higher risk populations, they recommend offering a second screen. If you feel you are not part of that high risk population, we do have a standard opt-out form. No big deal, just let us know. Around 32 weeks, moms who have other diagnoses with their pregnancies, like high blood pressures or high blood sugars, may start additional testing. My belly birth mamas, which is our word for cesarean. If we know that we're needing to schedule a belly birth for you, we start doing that around 33 weeks for the 39-week mark so you can start planning and we can get you on the books. We continue the every 2-week visits though until you're about 36 weeks. Then we do one more pelvic exam to screen for group beta strep. We'll be explaining to you then exactly what that is and why it's important and what it means if it comes back positive. If you've already opted out of repeating your STD screening, then you also opted out of repeating your cervical cultures. So after 36 weeks, you start seeing us every week. This is when it gets real. You're sliding into the home stretch. This is when you want to bring in that birth plan for discussion and start your natural cervical ripening methods because you're now full term. Congratulations. Everything's on the table. My belly birth mamas will get off the train around 39 weeks. And then at 40 weeks, your due date, which remember, your baby does not have a calendar. This is when you have to start being patient. We'll also do some additional testing to make sure that it's safe to continue to stay pregnant past your due date. And then we want everyone evicted by 42 weeks. So for first time mamas, 41 weeks and 5 days is when we would start an induction because our inductions are not slow. I mean, they are slow. They're not fast. And for second time moms, your labor is usually about half the length of first time moms. So we start you at 41 weeks and 6 days. So as we go back to the other page, remember that this is out there. And first time moms, remember the average length of labor for you is about 24 hours. About 24 hours. So remember, that's just the average. Could be shorter, could be longer. I have a poll question. If you have a headache, are you more likely to take a Tylenol, meditate, or go to the emergency room? Certainly hope that we are not having headaches bad enough to go to the emergency room. But the polls are closing in 4, 3, 2, 1, closed. All right. We have more meditators than medicators today. Interesting. I wonder, and interesting that it's the same ratio as veteran mamas to first-time mamas. And my veteran mamas may be more likely to take a Tylenol. You may have already gotten some headaches from your little ones you already have at home. While we open this up, I'm going to take this question. What role will the high-risk doctor play at delivery time, or is he or she just monitoring throughout the pregnancy? The high-risk doctor is just a consultant. So they follow certain parameters during pregnancy and make recommendations for when delivery should occur, not necessarily how delivery should occur. And the second part of that question was, does high risk mean C-section? And that is a no. It just may mean when to deliver, like versus waiting for spontaneous labor. And the next question is ibuprofen safe during pregnancy? It is not, as you will see on this list. So safe medications in pregnancy, we have some common discomforts of pregnancy listed over here on the left in alphabetical order. In the middle, you'll see some relief measures. So these are things that we want you to try first before you try any type of medication. So if you're getting constipated, which is one of the super sexy things we didn't tell you was part of pregnancy, the first things we're going to have you do is try some dried fruits, some apricots, and drink more water, your fruits and vegetables, increase your roughage, decrease your meats and cheeses. And then if those things don't work over here in the third column, you see there are some medications that we recommend, including some things that we don't. So we are still, this cough and cold season is just kind of lingering on for everybody. So cough and sore throat and cold symptoms, all those things are listed on here, including the things that we don't recommend, like pseudoephedrine. If you get diarrhea, we don't recommend Pepto-Bismol. This list goes on. If you scroll down to the next page, you'll see some more upper respiratory symptoms, and then you see no no alfalfa for people with autoimmune disease. And then the warning, if you're not able to keep down food or drink for 24 hours, please let us know because we'll need to send you in to get some IV fluids and press the reset button there. So just remember, this is a thing. It is out here on our website, and I get questions all the time. Is it okay? Or what can I take for heartburn? And I cut and paste this link into the response. If you've exhausted everything on this list, though, because some people have now gotten wise to me and they start with, hey, Dr. A, I've already taken everything on that list. Okay, what else can I do? So if that's your answer, then it may be time for us to move to some diagnostic testing or some prescription medication. But definitely consult this list first because these are the most common things that are happening during pregnancy. All right, headed back to the website. And the next box we'll see there is the gestational diabetes screening test. Tricked you. I'm not going to look at it right now. We're not going to click on it, but I promise we are going to talk about it a little bit later. Next thing we're going to look at is weight gain in pregnancy because some of you are very, very concerned that you have not gained any weight, even though you are like 20 minutes pregnant. Don't stress out. It's okay. And some of you are also concerned about the opposite thing. You're like, I'm only 20 minutes pregnant and I've gained 20 pounds. So, how much weight are you supposed to gain during pregnancy? Great question. It is dependent upon how much you weighed prior to pregnancy. So, your pre-pregnancy body mass index, there's a link on here you can use to just click on it, put in your pre-pregnancy height and weight. It'll calculate your body mass index, and then according to that, tells you how much you should gain to support a healthy pregnancy. If you have twins, you can add 10 pounds to the upper number on each one of these. And if you look at that last column, the rates of weight gain are in your second and third trimester per week. So if you're not gaining in your first trimester, that's okay. Your food aversions, nausea, all of that stuff, it all comes back around. You will be hungry again. And you'll gain weight in second and third trimester as the baby starts to thicken up. Love a good chunky baby. All right, so do remember that this is out there as well. Birth preferences, we're going to click on that one too, because I did have a question earlier about whether about tub labor or tub birth. So some of you will be interested in making a birth plan. I will say as the practice has gotten older, we've seen less and less birth plans because people have kind of come to know who Full Circle is and what Full Circle does. But sometimes this helps for first-time moms with your anxiety and just kind of organizing your thoughts about a process that you've never been through before. So this covers everything from how you would like your labor to start, to what you want to wear in the hospital. If hospital gowns freak you out, don't wear them. It's fine. Pain relief, obviously, it is a hospital, so we have epidurals, we have IV pain. By the time you all deliver, I anticipate we will have enough nitrous for more than one person to have it at a time. And hydrotherapy is a thing now. So this is for labor pain relief, specifically just during the first stage of labor. When it's time for you to push and deliver, though, we do not do deliveries in the tubs. There are also showers there, so you can labor in the shower as well. So as long as you are full term, meeting the criteria in terms of how baby looks on the monitor and all that good stuff, it is just fine for you to labor in our tubs. And that's not something you have to order ahead of time. Those are available for anyone who meets the criteria. Other things on here too, just some important points. We don't strap you to the bed and starve you. So we encourage you to take in things that keep your blood sugar and your energy up while you're laboring because you have some hard work to do. You can push in any position, you can deliver in any position. Our standard is delayed cord clamping and immediate skin to skin. Early latching, the nurses are trained to help you with early latching for breastfeeding. There is a list over here too for standard medications that are offered to the newborn. You always have an opportunity to bring this list in and talk to the midwives about why these medications are recommended. What is their purpose? Does it apply to you? Is it something that we recommend for you specifically? Other things about breastfeeding and what your preferences are for how your baby is fed. For my twin mamas, there are some special choices there for you, which we'll probably talk about with you privately. And then my belly birth mamas, we do practice gentle cesareans here. And I think we have an advertisement on one of our social medias about gentle cesarean. And so just look for that. But just know Dr. Marrow and I personally were C-section moms for our first babies and then VBAC moms. And so we got together to try to make sure that the birth experience was still a birth experience across the board for everybody. So it might look daunting, but it is 21 boxes, and all 21 boxes do not apply to you. Most of you on this call have at least 21 weeks left in your pregnancy. So if you just dedicate taking one box per week, everything on here is a matter of preference or opinion. There's nothing really dangerous on here about selections. So just after your 36 weeks, this is what you want to bring in and talk to us about. All right, going back to the website, you'll see cervical ripening techniques because at the end of pregnancy, your only question is, how do I get this person out or these people out? So at 20 weeks, you can start your raspberry leaf tea. But most of this stuff really begins around 36 weeks. So you can see your acupuncturist, do some acupressure treatments, evening primrose oil, dates, clary sage. You guys can read. So week by week, there are things that we recommend on there. What you will not see on there is castor oil. And if you're wondering why, you should ask your midwife. She's going to tell you for sure why she does not recommend castor oil on this list, or you can ask me when you see me. All right, we're going to go back to the website again. And the next box is for first-time mamas and those who've had a C-section before. So do I have anyone on the line who has had a C-section and is trying for a vaginal birth after cesarean? There are only two answers at full circle. Either that doesn't apply to you or yes, and you're going to rock it. Love the positivity. Polls are closing in 3, 2, 1. Boom. All right. So we do have a couple of moms who are doing a trial of labor. Fantastic. So first time moms, this is for you too, though, because you're basically doing the same thing that our VBAC moms are doing. You're trying to avoid an unnecessary C-section. So baby's going to do what is going to do, but control what you can. These are things tried and true. You know, we do a lot of VBACs here, and over the years, this is what we've seen moms who are most successful, who have the best preparation, and are truly ready for their trial of labor. So just, see if you're seeing a chiropractor, doing your yoga and Pilates, only gaining the recommended amount of weight during pregnancy, working with a doula, being hyper vigilant about baby's position, because the most common reason that I do C-sections, you'll hear me say this again, is not because baby was too big, but because baby was in a weird position. First time mamas, don't get impatient and try to get induced as soon as you can if your body isn't ready. Trust your body and trust us. We're trying to get you what you want the safest way that we can get it to you. So remember that this is out there, first time moms, because our labor to cesarean rate, again, is always under 15%. And we definitely want to keep it that way. Don't mess up my stats, girl. And my VBAC moms, our VBAC success rate is always 70% or over. So don't you mess up my stats either. All right. So just remember this is out there for ways to reduce conversion to cesarean. Going back to the website for our last little box, look at this cute little guy. If you have a little guy and you want to have him circumcised, we do that in the office. We don't do it in the hospital. He just became a baby. He's never done it before and he needs a moment to adjust. And so you'll bring him back to the office. Just let us know at delivery, and our OB coordinator will send you a portal message with his little appointment, and you can bring him in and we'll take excellent care of him. My babies do not cry. Their circumcisions. We have a good time. We have a conversation about, life. All right. So full circle jacks, remember this is out there. Remember that one. Gosh, I did not mean to say remember that the gestational diabetes thing and then have the salted caramel mocha pop up, but it is what it is. Those of you who are concerned about weight gain and saying, Dr. A, I don't know what's going on. I'm only drinking coffee in the morning and I'm staying active. Are you drinking coffee or are you drinking the salted caramel mocha monstrosity that's so delicious? One of my faves. Holy cow, the calories. Did you know that that pregnancy only requires an additional 300 calories per day? That's not a lot. It takes 10 kilocalories to maintain a pound of body weight, and the amount that you should gain is based on your starting body mass index. So let's say you're starting the pregnancy at 170 pounds. 1,700 net calories should maintain that for you. If your goal pregnancy weight gain is 25 pounds, that's an additional net 250 for a total of 1,950 calories. If we divide that by breakfast, lunch, and dinner, and again, this is assuming that you burn 0 calories, 650 calories per meal is where you should be hanging out net. Now remember, your baby doesn't know if you're eating the calorie or drinking the calorie. So please do not eat a 650 calorie meal and then wash it down with a 570 calorie mocha monstrosity. Because again, your baby's going to take that first 300 and then the rest you get to keep for Mother's Day. Enjoy. Also, at a certain point, though, after the baby has grown as much as he or she needs to, then they will also start to put on fat too. And we get babies who are a little too chunky in there, and those are harder to come out. All right, nutrition facts is a very busy slide, but just a couple of things. Really, my take home here are the things that are highlighted. Simple choices that you can make, like looking at the sodium, because in third trimester, when y'all start saying, Dr. A, my rings don't fit anymore, the first question I'm going to ask is, hey, how's your salt intake? Almost invariably, the answer to that question is, oh, I did have Chinese last night. So, yes, definitely pay attention to your sodium. There are small alterations you can make in your diet that will make a big difference in how you feel and how you gain weight and how the pregnancy progresses. All right, so talking about food, what can I eat? You can eat your fruits, veggies, whole grain, cereal. You will not give your baby an allergy to nuts or dairy if you eat those things. So if you want them, enjoy. For my coffee drinkers, you want to limit your caffeine to 200 milligrams per day. Do remember that caffeine is a diuretic. So you want to use the 3-to-1 rule and take in 3 times as much water as you are a caffeinated beverage. Um, Also, just remember if there's anything that we're saying, try to limit. There may be some bad side effects, which is maybe the reason for that. Sometimes babies can get irregular heartbeat from mommies taking in too much caffeine. So just keep that in mind as well. Herbal teas are fine. Our favorites in pregnancy are raspberry leaf, ginger, lemon, and peppermint. For my vegetarians or my vegans, your protein you want to maintain around 70 grams per day. I know there are some older pregnancy diets that encourage you to eat like 120 grams of protein per day. First of all, that is so much protein. But secondly, if you check, they all grow like 10 and 11-pound babies. And y'all, it is the year of the big baby. You don't want to play these games, okay? 70 grams is plenty. You won't have one of those little scrawny, underweight babies, but you also will not grow a giant monster baby that we're not able to get out of you without a vaginal bypass. Deli meats. You want some deli meat? Yes, you can. Just make sure that you are microwaving it for 30 seconds to get rid of any harmful bacteria. It does not have to be piping hot, fresh out of the microwave. Don't burn your tongue. But just make sure that you've microwaved it adequately to kill any bacteria. Same thing with soft cheeses. As long as they're made with pasteurized milk, you're fine. If you're buying it from like Publix or Trader Joe's, just flip it over. It says pasteurized milk, you're okay. If you're at a restaurant and you can't verify that the brie was made with pasteurized milk, then maybe you skip the brie for the evening. Canned tuna, you can have 3 of those 4-ounce cans per week. I personally think that that is quite a bit of tuna. But if you're a pescatarian and you're like, that's not enough fish, Dr. A, guess what? I have something for you. The FDA has a really nice document about fish, just all about fish. The FDA is awesome. They're not. But you can find lists here on what fish you should be avoiding because of methylmercury, what fish you should eat in moderation, which ones you want to eat a lot of because they're high in omega-3s, which is good for baby's brain development. So again, it's a 2-page document. There's so many fish on here. I'm not committing it to memory. Just remember that this is out there on the FDA website and also on our YouTube. You can look this up and eat all the fish that they say you can. Things you want to stay away from, though, is undercooked fish. So whatever fish you eat, be sure you cook it all the way through. So that yummy ahi tuna sushi, ooh, it's so good. Not for you. Also, your steak, if you are a foodie like me and you like your medium rare steaks, you will need to ruin your steaks for the next 6 months. Well done, please. For my kombucha drinkers, my kimchi eaters, those are fermented beverage and foods. If you've already had a little bit, don't freak out. You're going to be okay. But just know that your body does treat those something fermented as the same way it does alcohol. And to that same end, we don't recommend drinking alcohol in pregnancy because we don't know, honestly, the amount that is safe. For sodium, you want to keep it under 1,500 milligrams per day. And again, when you start flipping your food over and seeing how much sodium is in things, first, you're just going to be appalled that really you're only supposed to have 1,500 milligrams in a 24-hour period. All right, any questions about food before we move on to exercise? All right, sweet. Let's go. Exercise. It is just fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. You just won't feel like it yet, but just wait until your second trimester. Like, I know you're tired and you're nauseous and all this stuff, but your blood volume is going to increase by 50%. That increases your red cell volume, which increases your oxygen tension, and you'll feel more like doing your aerobic activities in the second trimester. Just listen to your body though. Like if you're not the Olympic athlete that you were prior to pregnancy, don't beat yourself up. You will be fine, and you will return to being the amazing person that you like. The question here is, I read to avoid pre-cut fruit. Should I? No, it's fine. Just wash everything that you eat. That's okay. If you were not doing anything before, it is okay, in fact, encouraged to start a new regimen. Doesn't have to be anything crazy because as you recall me saying before, sedentary lifestyle. Everyone's working from home now, sitting in chairs, kind of sitting back like this. It has led to these malpositioned babies. All these babies are sinking in with their head sunny side up, and only 30% of women can deliver vaginally like that. We want baby to be face down. Um, if you all have these little Fitbit watches that constantly track your heart rate and blood pressure and oxygen and everything else to make you even more anxious, if you're noticing that your baseline heart rate is higher, that is normal. That's a physiologic change of pregnancy. It should go up about 10 to 20 beats per minute. As long as you're not getting dizzy or lightheaded with that, it's okay. That is what your body is supposed to be doing. So please be active. For those of you who have said, oh, I do stay active, I walk all the time, your walking can be considered exercise if your heart rate on your little Fitbit is in the aerobic zone, which is 70% of your max heart rate. And you calculate that using the base number 220 minus your age. So let's say you're 30 years old. You start with 220, you subtract 30, your max heart rate is 190. So you should not be exercising for extended periods of time with your heart rate above 190. The aerobic zone, however, is 70% of that. So 133. So if when you are walking, your heart rate is between 133 and 190, then your walking is considered exercise. You want to do that 30 minutes a day, 3 times a week. If when you're walking, your heart rate is still chilling around 80 or 90, that is considered transportation. And while transportation is good, it does not count as exercise. Thanks for attending my TED Talk. What exercises are safe in pregnancy? Do you like cardio? Go for it. If you want to get on the treadmill, have at it. The elliptical, absolutely. Running, do it. Swimming, yes. Swimming is like my favorite because like y'all are super lucky being my summer crowd. Your belly is weightless and your joints don't hurt quite as much, and it exercises all of your muscles. Indoor bike too. If you're on the Peloton, my leaderboard name is Off My Meds 8. You follow me, I do follow back. We'll put some blue dots on the board together. You can also continue weightlifting. So we recommend lifting at whatever weight you were lifting prior to pregnancy. You do not need to increase your resistance during pregnancy because your baby and your body will do that. Squats. If you are an experienced squatter, carry on. If you have not started squatting yet, this is one of my favorite exercises to open up that pelvis, get that baby to descend in the right position. If you're not squatting yet at about 20 weeks, please give me 5 a day. 21 weeks, give me 10 a day. 22 weeks, give me 15. You're building all the way up to 50, and they don't have to be all in a row. You can do 25 in the morning when you hit the floor and 25 before you get to bed. Other exercises include Pilates and yoga. These are actually two of my favorite things. Any experienced instructor should be able to help you complete them with the appropriate pregnancy modifications. Things to stay away from. You don't want to do high intensity interval training after your first trimester. And it's not really the intervals, it's the intensity. You can do the low impact versions of these, but it's those sudden jerking movements. You don't want to shear the placenta off of the side of the uterine wall. Anything that has you lying flat on your back for extended periods of time, like excessive ab work. You can do side lying abs, you can do standing abs, that's fine. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, you will get lightheaded, you will get dizzy, and you may fall. And I do not want you to fall on your belly. Other things you want to avoid. Scuba, because of the changes in barometric pressure, decrease oxygen to the baby. Same thing with high altitude hiking. You can visit high altitude places. So if you have family in Colorado, go ahead and visit them. Just don't go hiking with them. Contact sports, please do not take up kickboxing. Had a question not too long ago about volleyball. Anything that has a ball flying rapidly at your belly, the potential for that, we want to avoid as well. And outdoor biking after 16 weeks has an asterisk because it's not an absolute no. It's just a warning that around 16 weeks, your center of gravity starts to change. And when you start to make those turns, you may fall over more than you actually do go around that curve. All right, so that's diet, that's exercise, and now it's time for a poll question. Now that we have talked about diet and exercise, can you prevent gestational diabetes with diet and exercise? The polls are open. I'm gonna have some water. And the polls are closed. All right. The answer is no. And I bet you those are my veteran mamas out there who already know what I'm about to say right now. Because the key word here is prevent. You can manage it, but you cannot prevent it. And let me tell you why. Because your number one risk factor for having gestational diabetes is your placenta. You know how any other time we want to blame our hormones? I'm crying at all the Publix commercials over the holidays and everybody's making me angry. It's got to be my hormones. There are other hormones too. Insulin is a hormone. And your placenta gives off hormones that tell insulin not to do its job. And insulin's job is to clear your bloodstream of glucose. And if insulin isn't doing your job, then you get this excess buildup of glucose in your bloodstream, which is essentially gestational diabetes, diabetes of pregnancy. The only time you would get this diabetes is if you have a placenta in there telling your insulin to take a break. So if you can figure out how to do this pregnancy without a placenta, and for those of you with twins, you have two placentas in there, so I'm definitely screening you. Then I won't screen you. But I believe everyone on this call has a placenta, so welcome to screening. For my moms who say, but I never ever eat anything with sugar in it. You do eat good carbs, so don't avoid your fruits or your whole grains prior to the test. Because you will get your body out of the practice of processing your good carbohydrates. If it is the ingredients in the drink that they have at the lab, never fear. I already have something in mind for you. Couple of different options. So we do have the Simply Pure drink, which is available here at the office. It is soy-free, it is dye-free, it is gluten-free, it is BVO-free, it is kosher, it is vegan, it is offensive to almost no one. There are some other additional patient-driven options that are available on the website. Remember that little box I said we're not going to click? We didn't click on it, but if you did, it would give you all the instructions on how to not eat before taking the test. It's a 2 hour fasting period before taking the 1 hour test. And it would tell you about the fresh test. It would go into glucoorganics and glucose tablets. So remember, all of that information is on the website at fullcirclejax.com. Preparing for birth. Um, Childbirth education classes. So I know some of you are going for unmedicated deliveries. Some of you are just going for vaginal deliveries, and you're just trying not to get an epidural so early that it decreases your chances of being able to be an active participant in labor. So on here, you'll see examples of classes for hypnobirthing, hypnobabies, Lamaze, Bradley. Supporting her is one for the significant other who's going to be supporting you during pregnancy. And these are, again, for informational purposes only. We don't, again, endorse any one or the other, but this is just a good place to start. If you Google childbirth education in Jacksonville, these people and some others will come up as well. But if you're trying for unmedicated delivery, definitely recommend a method class. Breastfeeding classes, as I mentioned, they are at HCA. We also connect to La Leche League for when they have group meetings as well. CPR for parents, every new parent should know infant CPR. If you say, oh, I've got this, I know adult CPR, I'll just do it with one finger. It's not the same thing. So these are some links here. There's the Red Cross for taking a class. And then there's Jax Mobile. This is a woman who will actually come to your house and do a private CPR class with you so you can be fancy. If you're already seeing a chiropractor, good for you. Make sure he or she is Webster certified. That is a special pregnancy certification that deals with how pregnancy changes the alignment of your spine and makes those adjustments to make your adjustments. See what I did there? All right, I believe we have another poll question now, and this one is about doulas. Who plans on working with a doula? Polls are open. All right, polls are closing. 3, 2, 1, closed. Oh, sweet. So many of you guys are planning on working with doulas. That makes my OB heart happy. All right. And then some of you are not really sure what a doula is. So glad you asked. Doulas are there for emotional and physical support before, during, and after labor. So the best doulas will, you'll meet with them in your second trimester, kind of bond with them a little bit. They may help you put together your birth preferences. They may come with you to some prenatal appointments. They may guide you toward which method classes tend to match your personality, your and your support person's personality. But they'll also kind of help you with employing your breathing techniques and changing positions during labor to make it as comfortable as possible, or help you achieve whatever type of birth you're trying, especially if you're trying for an unmedicated delivery, or just, again, to avoid an unnecessary C-section. VBAC mamas. Doulas are not part of the medical team on the clinical side. So they're not telling you you should take this medicine for that. You should like your blood pressure this or that. They don't prescribe medications and they don't deliver your baby because people say, well, I have a doula, I have a midwife, I have a doctor, I have a nurse. There's this whole team taking care of me. Yes, it's like you're going to the Oscars. You have a whole team taking care of you. But the place and the role for doulas is to provide the physical and the emotional support. We will be there to manage the medical portion of the care and keep you safe. They will make sure that you are heard and that you're able to advocate for yourself because that's hard to do between contractions. The best doulas that we've seen do come to your house when you think you're going into labor, and they do not leave your side until that baby is latched. And so we've been doing this for about 10 years now. We're very familiar with the community. The midwives have no shortage of opinions on who their favorite doulas are. So please, if you're looking into that, be sure to ask the midwives for some recommendations. Acupuncture, we do recommend for baby positioning and mommy comfort. When you come out of the bathroom at the front, you'll see cards where acupuncturists, pregnancy massage therapists, and those are people who we know specifically provide these treatments. Most places will do pregnancy massage in or after the second trimester. Most of them won't do it in the first trimester. Some of them request a note. We do have a pre-filled note. You can just ask us for that. We can provide it for you at the visit as well. All right. Breast pumps. Most of your insurances will cover breast pumps. We have QR codes in the room for a company that makes it very easy for you and very easy for us. Emphasis on very easy for us, okay? Because when y'all go and find these companies, they send us these 10-page requisitions that they want us to fill out. This company just wants us to sign the prescription that they've already figured out. So scan the QR code, put in your information. They will check your insurance to see which pumps are covered. They'll figure out which one you want. They will requisition the pump for you, create the script for us. All we have to do is sign it and send it back in. Help me help you, help me help you. So please, when you're around 20 weeks is a good time to do it, because usually from the time that you scan that QR code, you've got that breast pump in less than a month. So that's a good time to start looking into getting the breast pump that's covered by your insurance. Even if you got one in your last pregnancy, you can get a new one. It's a new baby, new pump. Postpartum care, because one day this will be over. For my mamas who had any issues during pregnancy with blood pressure, we'll see you back in the office a little sooner for a blood pressure check, typically at about the 1 week mark. If you had a belly birth, you'll be back in the office about the 2 week mark for an incision check. For mental health checks, we usually do right around 2 weeks as well, because 80% of women have baby blues in the first 2 weeks. But if those feelings persist past 14 days, then we may be looking at postpartum anxiety or postpartum depression. Speaking of which, if doulas are there for emotional support and physical support, when do you need that more than postpartum? So postpartum doulas are a thing as well. And again, there's information for postpartum doulas in the front of our office on those business cards. The motherhood space is a new and exciting opportunity here in Jacksonville. We're one of 5 cities in the country to receive a grant to extend postpartum care, because, in the US, we're not that great at it. But this is a resource that has daily programs with free childcare, yoga for moms, group therapy, individual therapy, outdoor therapy. And again, did I mention it's covered by insurance and or free of cost for you? So if you are identified as someone who meets the requirements for the motherhood space in terms of your scoring on depression or anxiety scores, then we will send a referral to the motherhood space or to Her Hope for licensed mental health therapy. And then pelvic floor therapy, because this is standard of care in Europe, because babies change things, whether you have a belly birth or a vaginal delivery. Just the weight of carrying a baby for that amount of time on your pelvic floor, we want to put you back as close to how we found you as possible. So we bring a nurse in 3 times a week to do pelvic floor therapy, and this is also covered by your insurance. And because you just met your deductible by having a baby in the hospital, nothing else out of pocket, this is actually a really good time to do pelvic floor therapy. All right, random frequently asked questions. We're almost at the end, y'all. You can sleep on your left side, your right side. You can sleep on your back. Yes, you can. If it freaks you out to sleep on your back, or you're waking up in the middle of the night dizzy, you can get one of those wedge pillows from Amazon, stick it under one of your hips. And then you won't roll onto your back. You can help paint the nursery as long as the room is well ventilated and you're wearing your mask. Probiotics are fine in pregnancy, as is dyeing your hair, including your eyebrows. That was a question I had before. You can get gel nails. If you're going into the salon, you may just want to wear a mask because of all the fumes that are in there. If you're traveling, summer break is coming up. So up to 37 weeks is fine. After that, we like you to stay close because, again, babies don't have calendars. Don't go have your baby with some stranger out there. But we want you to get out and stretch your legs every 2 hours, which you will do if you're drinking the appropriate amount of water. You can also, ouch, you can also use your salicylic acid, your benzoyl peroxide, most of your topical skin products, unless they have retinol in them. So retinol is the one ingredient you want to avoid. There is an alternative to retinol, a natural alternative. It's called bakuchiol, Bakuchiol, and that is it has the good properties of retinol without the dangerous properties to the pregnancy. Air travel is fine. For my twin mamas, you can fly until you're 32 weeks. For my singleton moms, you can fly until you're 36 weeks. But please, please, please be sure that you are wearing your compression hose and doing your calf raises, those toe lifts in the seat to keep your blood circulating, drinking lots of water, and getting up and going to the restroom frequently. The question I have out here is, what if you have a hemorrhage in your uterus? What is the best sleeping position? To be honest, it does not make a difference because your gravity is going to be the same no matter what side you're sleeping on. And because you all are my summer crowd, this is my summer random frequently asked questions. No roller coasters and no water slides for you. Sorry. Next year, definitely. All right, quick COVID-19 update, and then we're out. Vaccinations, ACOG moved from strongly support either way to strongly recommending them after studying 35,000 women who are vaccinated between conception and 6 weeks postpartum. They are okaying the Moderna and Pfizer vaccines, just not Johnson & Johnson because of its independent risk of blood clots, which pregnancy has the same thing. So don't mix those two things together. All vaccines were approved for booster injections. So if you are 6 months past your Moderna or Pfizer, you may get another one, typically early third trimester. So you'll have passive immunity to pass to baby and breastfeeding. Or if you're 2 months past your Johnson & Johnson, you can get another shot, but not Johnson & Johnson because you're pregnant. You would get Moderna and Pfizer because mixing and matching is okay. And there's no optimal time versus getting your flu vaccine, your RSV, or your Tdap because they work differently. If you do get COVID, there are no formal recommendations for ivermectin, azithromycin, or Plaquenil, so we don't prescribe those. What we do recommend is vitamins in these regimens. So vitamin D3, zinc, vitamin C, and a baby aspirin, 81 milligrams, because COVID and pregnancy has been associated with hypertensive disorder of pregnancy, and you'll reduce that risk by about 40%. At that point, we do start doing serial growth ultrasounds to make sure baby is not becoming growth restricted due to the vascular changes that COVID has been shown to induce in the placenta. Also, the supportive treatment at home is what's recommended if you do contract COVID. Remember, our website has stuff about sore throat, fever, cough, congestion, what it's okay for you to take. You really only need to go to the hospital if you're having difficulty breathing. So if you're short of breath or if you have a fever that you can't break with the appropriate amount of Tylenol, over 101. The next. We are back. We are back. For those of you who had babies during COVID and you're freaked out about who can visit and who can't, we are back to our usual pre-pregnancy numbers. So you could have 4 visitors before COVID. We're back to 4 visitors again. Again, your doula, who is your real doula, not your cousin who's pretending to be your doula so you can have 5 people, but your real doula is not considered to be a visitor, but part of your non-clinical birth team. We're not requiring masks in the hospital, the room, or in labor unless you are actually COVID positive while you're laboring. And even if you are COVID positive during labor and delivery, we don't separate you from your baby. We give you an isolate and an N95 mask and so that you don't pass it while you're breastfeeding. All right, last poll question. What things can you find on my website? Can you find the birth plan template? Can you find safe medications in pregnancy, what to expect at each visit, or are you a master test taker and know that all the things are out there? That's right, polls are closed. 3, 2, 1, boom. All right, please remember, we are social. This is a huge month, and so we're going to be posting a lot more than we have been because there's so many things. It's Women's Health Month, it's Endometriosis Awareness Month, which has ties to fertility. We've also done two things already on the maternal mortality crisis. So there will be a lot. We're on Facebook, we're on Instagram, we're on X, formerly known as Twitter. We are on YouTube. So please remember that we do have our series where moms tell their rock star birth stories that we're going to be bringing back because many of you came to us because of word of mouth. And so we ask that you pay it forward and tell your amazing rock star birth story as well. Question I have here, twin mama here. If I give birth vaginally in the OR, am I allowed to have four people still? No, you can have two people in there though, like your main support person and your doula. That's a good question. I always forget that about my twin mamas. All right. Thank you guys for rocking with me. I appreciate you so much. We will look forward to seeing you all in the office really soon. And you guys take care. Thank you again for choosing us here at Full Circle. Mwah.